Good morning. I hope everyone is doing great today. My name is Gary Gann, and I am a procurement counselor at Tribal Government Institute PTAC, located in Norman, Oklahoma. Today we have two special guests, Michelle Street and Karisma Horne from the U.S. Department of Health and Human Services, Office of Small and Disadvantaged Business Utilization. As Deputy Director, Michelle Street is responsible for the proper execution of the small business programs at the Department of Health and Human Services, 29 operating and staff divisions, and maintaining compliance with the Small Business Administration's reporting requirements. Since becoming a member of the HHS OSDBU team in 2016, Michelle has set her priorities on developing initiatives that will enhance OSDBU's internal and external stakeholder experience, elevating OSDBU's value in the procurement process, and increasing small business participation through taking a holistic approach to the OSDBU's service delivery system. Karisma Horne currently serves as a procurement analyst in the Office of Small and Disadvantaged Business Utilization at HHS. She promotes small business participation by supporting the OSDBU implementation of small business programs to ensure all small businesses have the opportunity to provide goods and services to HHS by providing assistance in outreach, market research, small business policy, and training. Today's discussion will be led by Karisma Horne, and Michelle Street will be available to answer some of your questions. Please enter your questions in the chat box and we will get to them at the end of the webinar. We also placed the presentation slides in a PDF that accompany today's webinar in the handout section of your control panel for you to have. I know all of you are ready to learn more about doing business with HHS, so Karisma, let's get started with today's training.
Thank you, Gary, and thank you for having us today. Let's get started. The mission of the Department of Health and Human Services is to enhance the health and well-being of all Americans. How do we do this? We touch the lives of everyone in this country. As for the OSDBU mission, simply stated, is to support the HHS mission through the utilization of small businesses where possible. The OSDBU is under the division of the Office of the Secretary. OSDBU reports to the Deputy Secretary in the Office of the Secretary. We administratively report to the Office of Acquisitions. Within the Office of Acquisitions, we have a Deputy Assistant Secretary. His name is David Dasher, who is also our Procurement Executive, as well as Katrina Brisbane. She's the ADAS and is currently acting as the Director of the OSDBU. One of the most important things you would need to know when you're trying to do business with HHS is how we're organized. In doing your research, you have to understand our operating division and our staff division. On the left is our operating divisions, which are areas that you're probably familiar with: the Food and Drug Administration, the Centers for Disease Control, the National Institute of Health, and more. On the right is our staff divisions, and they provide oversight to the operating division. The Office of the Assistant Secretary for Financial Resources is where the OSDBU sits. Here's a brief description to begin to understand the HHS portfolio. Here's some examples of some of our bigger programs. The National Institutes of Health is one of the largest biomedical research entities in the country. There's a lot of vaccine research done within NIH. There's about $1 billion spent on R&D a year. NIH purchases a lot of IT purchases of lab equipment, construction services, scientific and technical consulting. There's also a very large staffing contract for a scientific support, which is Kelly Services. They do about $280 million a year, and where there's a lot of subcontracting opportunities in that area. Some of the small business-friendly procurements within NIH include construction, IT, administrative support, and janitorial services. The Centers for Medicaid and Medicare Services deal with the fraud, waste, and abuse of Medicare and Medicaid programs. CMS has also implemented the Affordable Care Act, also known as Obamacare, and they spend about $2 billion a year in most purchases that are in IT. But some prime contractors include Accenture, Booz Allen, Serco, and more. They do a lot of contract center operations and call center support. CMS's most common procurements for small business include advertising, data processing, hosting and related services, as well as computer system design, administrative, and general management. Indian Health Services provides the health of American Indians, health services to American Indians and Native Americans. The IHS procures services and goods and suppliers to support federal activities and projects. These include medical and surgical and dental equipment, construction, renovation, and repair of buildings and infrastructure systems, computer hardware and software, and temporary help solutions in terms of medical and physician services. This is where a lot of the funds go to within this portfolio. The Food and Drug Administration. They regulate the manufacturing of food, drugs, and biological products and medical devices, to include veterinarian drugs, cosmetics, and also ensuring our food supply safety. They regulate the manufacturing of marketing, distribution of tobacco products. Some types of procurements they award are consulting services, public relations for advertising and educational, drug campaigns. The Centers for Disease Control. They respond to the disease and illness outbreaks like COVID-19 and Ebola. CDC spends majority of obligations in vaccines. However, they do have many opportunities under the simplified acquisition threshold. Some of their small business procurements are IT equipment, staffing, IT supplies, and lab supplies. ASPR coordinates the national response to disasters and emergencies. They're big in the news right now due to what's going on in the pandemic. Some big programs are BARDA, which support the medical countermeasures such as vaccines, but they also have an oversight in the Strategic National Stockpile. Some common procurements for ASPR include construction, professional, scientific, and technical services. HRSA focuses on improving healthcare to geographically isolated and economically or medically vulnerable. They allocate funds to end HIV epidemic, as well as they do a lot of grants and contracts in the bone marrow and cord blood donation program, which goes unknown. Some common procurements include convention and trade show organizing, computer service design, and other computer-related services. Here's a snapshot of some of our key stats within HHS. Geographically, HHS is organized into 10 regions. Each has a regional director. We have about 85,000 employees across 10 regions. Our buying at HHS is decentralized as evident. We have about 11 heads of contracting that make up decisions that oversee 50 contracting offices. To support the HHS portfolio, currently we have about 7 small business specialists, and HHS obligates close to $2.2 trillion a year. Here's our goal achievement for FY20. HHS has exceeded our small business goal, but we have a lot of work to do within HubZone and SDVOSD. Even though we did not make our goal, we continue with initiatives with SDVOSD and HubZone. If you as a small business is interested in our HubZone initiatives, where we're spotlighting HubZones on our website and showcasing them in front of acquisition professionals, please reach out to our OSDBU customer care at sbmail@hhs.gov. These are our top NAICS for HHS overall, 541 and 512, and 325, 414. As you can see, here are some of our top NAICS for small business. There's some overlap of the two, but there are definitely areas where you want to start taking a look if your company falls within this area. And I'm going to the slides pretty quickly. If you missed anything, you do have the slides during this presentation at the end, as well as if you want to refer back to them for question and answer. This is our HHS top prime list, all other than small. When looking to do subcontracting work, this is where you want to start. Our big 10 primes have focus in vaccines, pharmaceuticals, and a lot of IT. But all of these companies have subcontracting liaison offices where you could contact them for different subcontracting opportunities. It's a great way to get past performance and and you should take advantage of that. Doing business with HHS, here are some things that the OSDBU has come up with in no particular order, but all are equally important. First, we would like you to create a profile in our small business customer experience, which I will show you in an upcoming demo. We no longer accept hard or digital copies of your capability statement. We ask you as a company to create a profile, add your capabilities into SPCX. You can go right into the portal and upload and fine-tune your profile and edit and change whenever you want to keep your profile current. By uploading and fine-tuning your profile, it's searchable by everyone in HHS, and this is what you want. 2, we would like you to review our forecast. This can be accessed on our osdbu.hhs.gov website. We also want you to search betasam.gov for HHS sources sought, special notices, and solicitations. I'm sure that Gary at your PTAC has already shown you how to do that. If not, it's a great way to utilize them. We also would like you to attend HHS virtual vendor teleconference outreach sessions. They happen every second Tuesday of the month from 9 to 4. Registration usually opens 2 weeks prior at 7 a.m. and it fills up very quickly. You can attend up to 3 times a fiscal year as a small business. Also, there's a lot of OSDBU sponsor events on our website, which you can register for right from your portal when I show you the demo. We also have some office hours, which are put on by Deputy Director Michelle Street, where it's a Q&A where you can talk about your concerns or ask questions to the Deputy Director. We also want you to know how and what the agency buys. We purchase a lot of IT through the NIACS program, and the NIACS program sits within NIH. And they award and administer the CIOSP3, CIOSP3 small business. We also have CMS. They also have an IT contract called Spark. You want to check those out. You want to review the HHS budget in brief. It tells you from a money perspective where the money goes, and if you have if you have an idea on where the priority is, and you have a solution, and where the money falls, this is where you need to target. Every 4 years, HHS updates its strategic plan. And if you have goals that align with what you're doing and your priorities of the agency, depending on your solution, you can make sure you check it out there. We also like you to propose, if you have innovative ideas that meet research and R&D specific, and you have solutions, you can contact the SBIR and STT programs. We have a couple within NIH, FDA, CDC, and Office of Children and Family. All right, Gary, I'm going to switch screens and go to the demo. Can you hear me okay?
Yes.
Okay, awesome. I know you've worked with some of your clients to create a profile, but within this demo, we are going to get a little more granular and help create the profile. So to grow your business and learn how to do business with HHS through our small business programs, outreach events, outreach sessions, and more, as well as the HHS forecast, please register your company for the Small Business Customer Experience. And what you see on the screen right now is where you would go register. Here is the webpage, is osdbu.hhs.gov. You would click on the word register. Once you go to the website and register, in the right-hand corner, you hit the register button. You will enter your information, your company's done. You will enter your security information. If your email address you use registers the government point of contact entered in Beta SAMS, you'll be able to log in immediately. If the email address does not match the government point of contact entered in SAMS, you will have to ask the person who's the government contact to register, and you need to activate your account, and they will need to activate your account. Once your account is activated, you can then do the following. So once you register, and I'm on a demo site, so some of the information you see might just be typed in there. So you would go to your business, and you would go to edit your profile by adding your company's capabilities. You would upload in file management your capability statement. You make sure during your capabilities you add keywords to allow HHS acquisition professionals to easily find and search your profile. Make sure you add your company's logo, and you can do all of the extra adding files in the file management section. And once you complete that, they'll upload right into your profile. Make sure you provide details of your products and services so they can appear in your search. So during your capabilities and your keywords, be specific there. Also, where you want to go, and this is you have your industry side here on your profile. There's different tabs that will benefit you. I'll go over a couple during this demo and make sure you get some tools for small business. So the first one is in Tools for Small Business. You want to make sure that you, this is information on late payments, and in this section will assist you with resolving any invoicing issues. If you have any specific opportunities that we want to hear about, this section will take you directly to our customer care center. Another great tab is our HHS Opportunities Forecast. You as a small business user, you have access to this, and you would just click, search your title, the NAICS, or the operating division within this section, and opportunities will come right up. The cool thing is you can export and filter through those opportunities as needed. Another great tab is our, give me one second, is our targeting optives section, where you can see HHS spend per all of the optives that we went over today and more. The targeting optives is unique because they have these unique one-pagers. In beginning your research, you can check to see what the spending trends are for the different optives. Last but not least, we have a section right here that talks about our updated events. And this is a section where you can view and you can register for an event right on the portal. And once you do that, you can sign up through Eventbrite, and it will come right to your email. It'll be specific about, it'll talk about specific information, what you need to know about each event and how you register. Also, what is good about this event section is it talks about all the upcoming events, as well as it shows our small business FAQs, why you provide capabilities statements, your meeting request, how you request a meeting with the OSDBU director, some business development information, and more. All right, Michelle, do you think I missed anything? Or Gary, in your basic registration and talking to your businesses that you had questions about, or we can just jump right into the Q&A.
Karisma, I don't think you missed anything. I think it's a good opportunity to drive the conversation through the questions.
All right, thank you, Michelle.
Okay, great. Okay, we do have one question so far. We have a client that has been reviewing the 2021 through 2025 Vaccines National Strategic Plan, and they have technology that can directly support 3 of 5 strategic goals and can support COVID-19 response with automated vaccine management. What is the best method to engage the appropriate HHS leaders, OA, SH, and OIDP to present this technology with the most engagements now being virtual? The client is a SDVOSB, GSA, and VA-FSS contract holder.
So there are a couple of things that you can do. Thank you for the question. And, you know, I know that we are constantly looking for innovative solutions to address our response to the pandemic. So that being said, one of the ways to make your offerings known is a couple of ways. There are provisions in place to submit an unsolicited proposal. And for those who don't know what an unsolicited proposal is, it is when you are proposing a solution to the government that is not in response to any RFP, any type of solicitation, or broad agency announcement. So if you have an unsolicited proposal, you can submit that to the OSDBU. The other thing is that you can tell us exactly what area that you believe, you know, it could be ASPR, it could be BARDA, it could be NIH. There are a lot of different areas in the HHS that are responding from a vaccine perspective. So, you know, we would have to, you know, work a little closely to target what area that could be. But one of the things I would consider is an unsolicited proposal. You can look up the definition of unsolicited proposal in the FAR. And I believe we also have resources on our website, Karisma, if you want to go to that, to the industry tile. If you go over there, there should be some interesting information there on unsolicited proposals. Oh, you're in
Sorry,
the test
Michelle,
site, so it might
I'm
not
on the
be
test
there.
site. Give me a second.
That's right. I'm sorry, but maybe you,
No
if
worries.
you have access to the live site, maybe you can go to the live site and pull that up. And so we can take the
Yes.
next question while Karisma is searching for that information. I hope that answers your question.
Okay, great. Can you provide the contact information for the HubZone contact you mentioned in your HubZone initiative?
Gary, the contact is our OSDBU customer care, which I put in the chat, but maybe you could share it with the audience. Yes, and for the subject, just put HubZone initiative, HubZone information, and they'll get that directly over to me. If you are specific HubZone, you can email me at Karisma, KARISMA, .HORNE at hhs.gov. And I'll put that in the chat as well.
Okay, yeah, and I did share that answer with the group.
Thank you.
Michelle, I'm not seeing any further questions at this moment.
Okay, and I just wanted to note that if you do have questions on how to submit an unsolicited proposal, I see that it wasn't yet updated to our site. So you can send that to sbmail@hhs.gov and we'll get you some direction over there. So if you email them today, we'll be able to get that to you.
As well as, Gary, I know you spoke of a lot of your clients having some NAICS requirements within construction and things like that. For Indian Health Services, the contact for the small business specialist is Jonathan Ferguson, and I will put that information in the chat. And he spoke of you as a PTAC as well as your customers, and I'll send you this information separate as well as to joining some of the monthly meetings with the Bureau of Indian Affairs with Miss Jacqueline Wolf. So I'll send that to you, but that was based on our conversation and some of the capabilities of some of your clients as well.
Oh, yes, that would be excellent. Thank you.
All right, and he also spoke about construction being within the Buy Indian. So if you wanted to, the clients do some more research regarding that. And if you have any additional questions, you can reach out to the SB Mail or Jonathan Ferguson.
Thank you.
I just highlighted it on the screen if you could see that and put it in the chat.
Okay. Thank you. We have another question. How enforceable is the Buy Indian Act?
How enforceable? I'm not sure I understand that question. If we can get some clarification. What do you mean by how enforceable is it? Well, okay, let me put it this way. Buy Indian is now listed in statute. It is something that it is a set aside preference program that is utilized by the Department of Interior as well as HHS Indian Health Services only within HHS. I think that from my observation is that the Indian Health Services takes great pride in utilizing Buy Indian where they can. They've done a lot of work to work with not only Interior, but other stakeholders in Congress to make sure that it is a successful program. And so to that end, I would say that in terms of enforcement, they have a vested interest in the stakeholder community that want to see that program succeed. If there are any areas in which you don't find that the program is working as intended, you can always let us know, and we will get with the powers that be within HHS to make sure that the program is being executed as intended.
Okay, thank you for that.
You're welcome.
Yeah, I'm not seeing any questions at the moment.
Karisma, you want to talk about some of the things that we have coming up as people think about questions? I know, isn't there a listening lab or something like that next week?
Yes, ma'am. If you go to our website under events, we have our HHS Access to Success Listening Lab. Can you see my screen, Michelle?
I can. I can see your email.
Okay, sorry. I lost my screen. So anyways, if you go to, once you log in, and you don't have to log in to have a profile to see our website, but once you do log in, or if you go to our website, you will see our, give me one second. You will see our different events, and we have a couple of coming up, and it's our Access to Success Listening Lab, and that is on February 10th, I believe. And you can register. If you wanted to register today, you can before it closes. And in this listening lab, we will have panelists from the SBA as well as ACF on how to engage and connect with those different offices. So that's where you can register. We do have another event is we do have our upcoming office hours where Michelle and I are on, and it's an awesome event. You can only come up to one time a year, but the event is so awesome because you have firsthand with the deputy director, like you have now, where the event is basically all about you. You can come and ask any questions, concerns, anything you want to know. You can come ask in this session. It's not a capabilities briefing, it's just a Q&A, and you are with a group about 30 other small businesses, and it's a whole networking as well as Q&A. So make sure you register for that. The next one is upcoming on February 11th, but the registration closes on the 9th, and I believe when I looked at it last, there's about 6 more spots left. So if you want to register that for that while you're during this session, you can. And last but not least, we also talked about the vendor outreach session, and what that is it's small business matchmaking with small businesses and small businesses and small business specialists. Is about 15 minutes long sessions where you matchmake throughout the day for the small business specialists and operatives that you're interested in. For those of you who are interested in the Hub Zone initiatives, I do have the session on there. So you make sure you register for Hub Zone. We also have primes each month. 2 primes come to the session. And for the upcoming one, which is the registration has already closed. But for future ones, what you can do is have up to 4 optives appointment, 1 Hub Zone appointment, and 1 prime appointment. And these, based on the NAICS of the prime, you can come to the event and pretty much do your elevator speech and things like that and tell about your capabilities per octave. So those are events that you really want to attend. We used to have them in person, but now due to COVID, we have them virtually. So any more questions, Gary?
We did have one more question. We have a client that would like to know which HHS office is engaged in fighting the opioid crisis.
Okay, hi. So one of the things about HHS, that's a great question, and it's a good opportunity to share a little bit more about how HHS works. So it's not like we have one agency that responds to any one pandemic or issue. So for example, as I mentioned before, we have several areas within HHS that deal with COVID, for example. We have CDC that does outreach and education. We have the NIH, which conducts the vaccine research. We have ASPR through the BARTER program that does vaccine procurements and also has the stockpile. The same is true with the opioid response. So it depends on where you want to enter the conversation. Is it a research? Is it education? Is it funding? Is it, what exactly about opioids are you interested in? What area are you interested in working in? And that will help guide a better answer in terms of who would be best for you to speak to. I hope that helps.
Okay, that's great. Okay, I'm not seeing any other questions right now.
All right, Gary, since there are no more questions, you do have the follow-up information where your client can reach us, as well as if you have any additional questions, you can contact me. And is there anything that you had on your agenda for today?
Well, we did have one more question that looks like it might be a good one.
Okay, perfect. We have time.
Okay, just one more question here. Do you have any suggestions on how to search for or design/build for wireless system connectivity, broadband?
I'm not sure that's a question for us. Yeah, can you say that question one more time?
Yes. Do you have any suggestions for how to search for or design? Wait, it says any suggestions how to search for, design/build for wireless system connectivity?
No, so that's outside of the scope of the services and information we provide, but it does bring up a good point. I think that folks would do well to understand the resources that they're speaking to, and I think some small businesses are challenged in understanding who can provide what information. And to no fault of your own, I mean, sometimes there's not enough information, and sometimes there's a lot of information, so you just don't know where to go. So you just put the question out there, ask, and then in hopes of somebody being able to point you in the right direction. So there you have resources for small businesses in terms of you have administrative resources, you have operational resources, you have technical resources. So the OSDBU is not an operational resource. You have the OSDBU, you have the SBA with SBA programs like the SBDC and the PCRs. You have the PTAC programs, which are run out of Defense Logistics. So your PTAC programs can help you get that kind of information. But then you also have trade associations that would be more along the lines of a starting place to meet with others and that hold conferences and talks like we're having now that would be able to guide you in more technical questions like the one that you have today.
Okay. Yeah, I think that she was wanting to know, um, if there's anybody within HHS she could reach out to provide services for, wireless services just for the HHS divisions.
Okay, so you're asking who needs that in HHS? The question was
Yeah.
worded a little backward. Okay, so if you're wanting to know who provides that, everybody needs that. I mean, we're in a virtual environment. We all use telecommunications. We can all use different types of things, right? So it might not necessarily be HHS. It might be GSA because GSA holds a lot of the leases and the building and the construction and things like that. So I would need to get more information from you because it's not that standard. So because sometimes even though we all use something, there are cases when we buy separately, and then there are cases where there's one buyer for a group or the entire enterprise. So it's really hard to say. It depends. One of the things I would recommend that you do is get your capability that was kind of broad, and have a discussion with the small business specialist to see if there are areas within the portfolios that they support that could use your services. Also, you can search contracts that we've already spent through USA Spend, and to see who has procured the types of services that you are offering, who has procured that before, and chances are they'll procure it again. So that is also a good way, not just with HHS, but within other areas, all areas of the federal government, to find out who buys what you're selling.
Also, Michelle, I wanted to add to that on your profile, and I skipped this portion. Within your capabilities, on the 4th tab is the HHS Operating Divisions tab. And within that tab, you can actually show your value add, what your offerings are specific to the optive that you're interested in. There are little narrative boxes where you can put little narratives. Make sure, I looked at a couple of profiles already. Make sure you do not repeat what your value add is per optive. Make sure you're specific per optive in doing that. So if you have any questions, you can email us as well. Thank you, Michelle.
Okay, great, no problem.
Well, Karisma and Michelle, thank you so much for joining us today and providing an excellent presentation. We certainly appreciate this opportunity. And we're going to go ahead and close the webinar. So everybody have a wonderful day, and let us know if you have any questions, and we will reach out to HHS and try to find you an answer. Thank you again.
Great. Thank you for having us. Thank you.
Thank you, Gary.